During my time as a salt sister in New Mexico, I had the good fortune of becoming acquainted with Mrs. Ellen Hagaman. She has a great deal of experience with accompanying young women in the birth process, and she has so many stories of the pressures young girls are under from very young ages at school to use birth control. It's even legal for schools to pressure young girls to do this, and not to mention boyfriends and other things. And then after they're married and they become pregnant, going to the doctor for the least problems, they are under pressure to abort, to you go through cesarean for unnecessary, unnatural reasons at risk to their health. I suppose this is a money-making thing for doctors, or they're just misinformed about the risks involved unnecessarily. And then to, of course, undergo sterilization, like, oh, you're having a little problem with this pregnancy. I think maybe this is your last one. And the young women don't always know their options or their medical reasons or the alternative opinions or the morality behind this that they should know as Catholics. And then even in the beginning with breastfeeding, they're encouraged to use formula and to abandon breastfeeding. It's all so bizarre. Our society has many strange values pressed among young women, and without someone who's been through the experience or can help them navigate this, they're really on their own and very vulnerable to a lot of confusion and even health risks, not to mention the risk to their babies and to having more children. And so I would really encourage you to listen to Ellen's knowledge and wisdom in this area, because she's encouraging Catholic women to become doulas. Now, this is sort of a new term. You might not be familiar with it, and it's used in different ways if you Google it. Some people, they use it in different ways, but Ellen wants to use it as a way of just providing morale and morality from one woman to another, especially one who's been through labor herself, and she knows her Catholic moral values, to impress the young lady on what her choices could and should be. And so I would encourage everyone to listen to Ellen. Fathers should know this about what their daughters or their wives are going through, and young men what their girlfriends or their fiancés might be facing. And also, many ladies, I would like you to become doulas, if you can, to offer yourself as an accompaniment to young women who are going through pregnancy. Make sure they have the moral support they need. So God bless you for listening to Ellen. She's really worth listening to it. Thank you.
Hello, my name is Ellen Hagaman. I am a doula in Mora, New Mexico. I am speaking on abortion and the assault on women's health care. The word doula means woman's servant. In the Bible, in the original Greek, when Mary said to the angel Gabriel, "Behold, the handmaid of the Lord," the original word was doula of the Lord. We use that term right now mostly for birth assistance, a few other things, but mostly birth assistance and those things leading up to birth. I'm speaking both on my experience as a doula, which has mostly been networking and assisting with pre-birth, also from personal experience and from the women that I know and work with in our women's group here in Mora. I think the first thing we really need to look at is families and what is affecting our families today. Why are our families being lost to abortion and addiction and divorce? What is it that's happening in this downfall of society? Society is built mostly of families, and societies struggle more when families are struggling. And the respect for families, individuals, and God is diminishing. We are having more economic troubles. We have more abortion. Suicide rates are pretty high. We've got all these bombings and attacks. You've got your child abuse rates up. Your infanticide rates are up. Your divorce rates are up. And these are all horrible statistics that we're dealing with, but we're all dealing with them on a personal level as well, on a family level. We're all seeing this in our friends, our families, our homes, and why are we seeing so many broken families? Even our two-parent families are struggling, and they feel less confident in the strength of their marriages and the strength of their family, and they feel less supported by society and altogether less confident in their role as parents. Society teaches that we must do as we are told without thinking. We have the media telling us what we're supposed to do, what we're supposed to think, what we're supposed to feel, what we're supposed to worry about. We're told by our teachers, by our doctors, but the authorities we should be listening to, the church and our parents primarily as children, is usually ridiculed and put behind, not on first base. This starts at a very young age. On average, children today rarely have a parent at home, and they are placed in daycare, and from there they go to pre-kindergarten and then kindergarten. This is very hard on young children. It's very hard on them to be with inconsistent adults. The adults are changing. They're adults that they're not going to be familiar with later on. They're not going to be a permanent part of their life, and they change very frequently, as do the peers that surround them. And they have much more trouble forming the bonding that they're supposed to, both with their families and with their teachers, that they're supposed to do as children. They're not given as much affection as they're supposed to. At young ages, a whole lot of our affirmation, our feeling of self is given by the affection and the family situation that we're in. And in school, this is much harder to take place. It's discouraged for teachers to be very affectionate with children. And it's hard for them. It's hard for young kids not to be praised and hugged and told they're doing a good job. Or when they are disciplined, it's by people that are not their family, and it makes them feel more nervous and more uncomfortable because they don't have that same bond of trust and the idea that this is where they belong. So already we have that lack of belonging and the loss of stability for our children. They're also sitting down all day. Well, not technically all day at your younger grades. There are recesses, but for a much longer time than they're supposed to. Our kids are sitting down, which we have child obesity and attention deficit disorders and all kinds of things as a result to not moving enough. It also encourages inattention. They tend to not focus as much. Little kids are supposed to play. They're supposed to run around and be encouraged and learn a lot by watching their families and their consistent time. But this is, again, it's all very confusing for young children to be in these situations as they're growing. And it continues as they go on, and it gets a little bit harder as they get older. We also notice here that we see our children as commodities. We have our school industry is one of your biggest industries in many small towns, especially small towns like I'm from. That's where your jobs are. Your job percentages are based on and how many teachers they're hiring, how much they're going to get paid. They're based on the kids' performance, on them, what their test scores are, what they're going to be doing. And we can see from the test scores that it's not working very well. We can see from how depressed our children are that it's not working very well. But it's something that isn't frequently addressed as to what to do about it. Then what happens is you have the kids start hitting puberty. Puberty is hitting at a much earlier age, particularly in the cities, according to National Geographic, and some city areas, particularly in places in New York. Puberty is starting to hit at the age of 6. Some girls are starting to get their menstrual period at the age of 6. And this is theorized to be to, again, the inactivity, obesity, but also the hormones present in the water and in our plastics. A lot of this due to the birth control pill and just the different things we're using to soften our plastics, apparently. But it's not a good thing. It's not a good thing. Puberty is hard. It's hard for boys. It's hard for girls. Your hormones are raging. You're very tired. You need more sleep. The American Medical Association has been advising our schools in America that they should start later, particularly for middle school and high school, because kids do better when they've slept. They're less depressed. They focus better. They pay attention more. But that just doesn't work very well with the schedule that we're putting our kids on these days. So it's rarely done. There are a few schools that do it, but it's rarely done. This is the age where it begins to be a little bit harder on the girls because the boys are now getting stronger. They're getting faster. In our present day culture, the girls are told that they can and should keep up with the boys. It's not, of course, that girls are any lesser than boys, but they are not as fast and they're not as strong. Their hormones are doing something a little bit different than the boys are doing. They begin to have their menstrual period. And this is when things really begin to get a lot more difficult for the girls in school. In the Bible, women on their menstrual period were supposed to stay apart. They were supposed to go away during their menstrual period. They were unclean. It's a little bit difficult for me as a modern woman to picture because my life doesn't tend to stop around my menstrual period, but it must also have been a little bit of a relief, particularly on the younger girls, because this is a time when it's hard to be out in public. You're not feeling good, you're cramping, you're bleeding, which is embarrassing on its own. You have to go to the bathroom much more often. You're tireder, and your muscles are hurting, and your hormones are... It's a hard time for girls. The girls get more depressed at this time, and they start falling behind. They're not feeling good. They're much more likely to cry being girls, but also young people in school at that age. They're more likely to be crying a lot. Their parents are worried about them, hopefully. Their teachers notice and are a little bit worried. The school nurse is worried. And what happens is usually the girl is taken to a doctor or a nurse who advises that menstrual cycle is being too hard for her, and it would be much easier to have something to even it out. Now, normally, after a few menstrual cycles or a couple years, the girl's cycle will even out on its own and become less difficult. It'll also become easier for her to deal with because she'll get used to it. But it sounds like an easy fix, and it's often offered compassionately, but what happens is very bad for the girl's body. Hormonal birth control has many side effects. The worst on the young woman is that her body doesn't learn to adjust to its own hormonal pattern. Hormonal birth control tells you that you're pregnant. So her body thinks that she's pregnant, and it signals her body all kinds of wrong information, which also affects her moods and everything else going on. It increases the risk of cancer, breast cancer, and it's not healthy for the growing girl. It usually does help a little bit, the periods, to be less hard. Not always. Often the girl just learns to stop complaining because she doesn't want to continue to be made fun of or to be the center of attention or to have people worrying about her. So she's on the hormonal birth control. Everything seems to get better, at least from the adult standards. Our schools also have a goal to get girls on birth control. Of course, this is in all schools, but the New Mexico Health Department has stated that it would like all young girls 11 and up to be on hormonal birth control. Both New Mexico and California have even suggested that the IUD is the most effective, which is one of the most dangerous, of course. And both the boys and the girls, as we know, once they're on birth control, they're both encouraged to use birth control, and they're both informed and encouraged to be sexually active. It's taught in our present society. It's taught that it's healthy and it's normal. And many of the girls are already on birth control anyway. Once they're on birth control, they're much more likely to become sexually active, which for the boys and the girls, but especially emotionally for the girls, this becomes very difficult because, as we know, you then have broken hearts, you've got sexually transmitted diseases, you have depression, and you have a responsibility. It seems like it's the girl's responsibility not to get pregnant. She may not get pregnant, and it's supposed to stay safe and fun, and she's not supposed to be too depressed, and he's not supposed to care too much, and it's just supposed to be fun. But it usually doesn't end up that way. It usually ends up with broken hearts and often pregnancy. The pregnancy is then, in our schools, we now pass out Plan B, which is available through our Title X government funding, and the girls are given this here and in the school. A lot of the schools that I've read about and talked to in different states, this is given to them very frequently without a pregnancy test. So that isn't healthy or good for the girl. Anyway, her parents are not informed. She may not even have been pregnant, but she then feels the guilt and the shame as if she had had an abortion, and there will be no way to determine whether or not there was an actually a life lost, or whether or not she was just given the pill. And she can ask for this frequently during her school years, and even the boys can ask for it for the girls. In some of the situations I've talked to, there have been boys that have gotten it for their girlfriends many times, which again is encouraging lack of responsibility. It's encouraging lack of respect in relationships, and it makes it harder for commitment and a stable relationship later, as many sexually active partners you've had, and heartbreaks and abortions, potential abortions. It's very difficult for our young kids to learn responsibility and how to be in a trustworthy, stable, lasting relationship, either with their parents, their teachers, and especially later on in their sexual relationship, because everything is in a disposable society. But we're still looking at the health of the girl. So after her high school years, usually in college or after college, many women decide that they do want to have a baby. And hopefully it's within marriage, but even without, she now has to try to get off of birth control. And for some women, this isn't difficult, but for many, and most of the women that I've worked with, this is very hard, both to conceive. It often takes 1 or more years, sometimes many more years, to conceive after you've been on birth control, because your body is just used to thinking that it's pregnant. The lack of the hormonal birth control in the woman's body is now, sometimes for the first time, learning how to adjust to its menstrual cycle naturally. One woman that I know at the age of 30 got off birth control for the first time, and she hemorrhaged so badly that her nonstop, when it wasn't her period even, the doctor advised that she never get off hormonal birth control and should not try to conceive because she would likely die. So she, as of yet, has not gotten off of birth control, but it was very difficult for her. So she's off the birth control. Hopefully she's able to get it out of her system without too much trouble. There's often a lot of trouble involved. There really is. So once she's off the birth control, and hopefully she manages to conceive and she's pregnant, we still have this idea that's being presented in our society that women should keep up with men. They should be working. If they want to be mothers, they should be able to keep up the same schedule that they've been doing. And this can be very difficult. You're pregnant, you're tired, you're either working or in school, and you're not feeling very good, especially if you've been having trouble conceiving already due to your hormonal birth control, which, oh, by the way, hormonal birth control itself causes about 1 abortion per year in a woman, because her body will reject a pregnancy if she gets pregnant, thinking that it's already pregnant. So there's already that issue going on. Our theoretical woman is pregnant and she's tired and working, and what usually happens is they then go to the doctor, and I don't know how many people know, if you're not a young woman right now, how often pregnant women are advised to have abortions. It's often said very kindly, look, you're tired, this obviously isn't a good time for you. You have too many children, your finances aren't good. Whose finances are good these days? It's just not a good time for you. An abortion you really might want to consider it. And often it's said less kindly. I've had girls come to me crying, saying that their doctor was very firm and rude with them, even a midwife for over an hour, trying to convince them to have an abortion, even when they did not want to. So she's often at the early stage encouraged to have an abortion anyway, that it's no big deal, it'll be, and later, maybe sometime later she'll be able to conceive, or maybe not, maybe it's just not a good financial fit for her. Hopefully she does not have an abortion and she continues her pregnancy. Lots of times she is still working and tired, though. She's very tired. And then we're getting ready for our labor. This is a very difficult part for most women. Labor carries with it a huge fear today. We have, thanks to our modern advances, we have many, many ways to help with complications, which is a good thing. It's a good thing. We want to save babies' lives. That's a good thing. But we're so busy monitoring and using our medical system that we forget that birth is not necessarily a medical event. It happens naturally, and unless something's wrong, we don't really need a lot of interventions. And one of the biggest aspects that affects a woman's birth is her state of mind, whether or not she feels calm and collected, whether or not she feels supported by the people around her. We have a very high rate of cesareans, both pressured by doctors and women selecting them, but also because of your cascading effect of interventions. So many interventions happening during birth that you just end up with a cesarean. Most of the pregnant women I know, even if they've had several children, are very nervous about birth. They're very afraid of birth. It's hard for them not to be. They want to be calm and collected. They want everything to go well, but at the same time, they're so worried about doing things wrong and listening to their doctor. One of the things that's encouraged the most, that's very difficult during labor, is that they want you to be on an IV and they don't want you to be moving around very much. Very hard to give birth sitting still. It's hard to sit still even when you're not pregnant, but when you are pregnant, it's very, very hard to sit still when you're stressed and pregnant. And your most pain-free labors are those women who are able to move around, who feel comfortable, who are able to move with their contractions, move with their body, who are not given artificial hormones to increase their labor or to painkillers, or you see your less difficult labors, your most natural labors. But occasionally you do need your interventions, but it's hard to tell when they're actually necessary or not. You have things like your episiotomy. An episiotomy is cutting the vaginal folds so that the baby won't tear when it comes out. Thought to be a good thing by many doctors, but we're realizing more and more that if a woman tears, she tears in her weak spot, whereas if she's cut, it leads to more problems later on, prolapse uteruses, things like that. But basically we just have a very invasive medical approach to birth, and it's very hard for a woman to relax and pray and birth naturally. Also, either during her pregnancy or directly after the labor, most women are offered the option of sterilization. This can be offered very forcefully, very kindly. Obviously, this pregnancy was too hard, the labor was too hard. Almost every labor feels too hard, especially if you have the spirit of panic there and everybody a cesarean and so many complications. And if you've already had health problems with your hormones, often due to hormonal birth control, you will be encouraged to tie your tubes, to sterilize yourself. And obviously you would want more children, but this was just too much for you. You need to take care of yourself. And rarely is the idea of rest and support and naturally managing your cycle seen as an alternative to sterilization or an alternative to not being pregnant, because all complicates pregnancy a lot. So many women do then sterilize themselves due to this same fear and the same difficulty. And then we have nursing the baby. Nursing is known to be what's most healthy for the baby and most healthy for the mother's body as well. It reduces breast cancer and other cancers, and it's very, very good. God knows what he's doing. It's very healthy. It's very good for both of you, both the mother and the baby. But especially if the mother has just had a difficult labor and she hasn't been handed the baby, bonding can be an issue, so learning how to nurse can be more difficult in that area. Sometimes it takes a little while, getting comfortable with it. It can be painful at first, and there's often those helpful nurses that are like, well, why don't you just do a bottle now until you're ready, or we'll just maybe this just isn't for you, or maybe next time. So the woman is already feeling intimidated. Pregnant women are very hormonal. Women who have just had a baby are even more hormonal, and the impressions that the people around us, especially when we're putting ourselves in their care, give us, even if they're just having a bad day, it can have a huge effect on our perception of ourselves as a mother, our births. I've talked to several nurses who have become doulas now that they've retired, just because it was so hard for them not to be able to spend the time that they needed to spend with the pregnant women there. They could see that they were struggling. They could see that they needed somebody to hold their hand. And we don't usually give our nurses enough time, our doctors enough time in their shifts to help. But we do also have to look at the fact that we have a society that feels that abortion is okay. We have a society that without meaning to, does often look down on pregnant women, and you get more people making fun of you in the grocery store for being pregnant or for having children with you, and it's very interesting. It's a different world than some of the older women are familiar with. It's a different world for a pregnant. So she's trying to nurse the baby, and she knows hopefully she knows it's a good thing to do, but it's intimidating. So most of your new moms get intimidated right there. Let's say that they persevered, they brought the baby home, they managed to nurse, and most breastfed babies do not gain weight as quickly as formula-fed babies. That's not always true, but it can be true. And then there are a lot of helpful pediatricians who say, well, maybe you should supplement. Your baby just isn't gaining enough weight. And of course, what we all want is our babies to be healthy. So many women then listen to their pediatrician. They start supplementing with the bottle. Once you start supplementing with the bottle, it's much more confusing both for the mother and for the child. And you usually give up on breastfeeding right there. I've had so many young women I've spoken to that have not breastfed at the advice of their pediatrician, that it just wasn't working for the baby. It's such a tragedy. It's such a tragedy that we're not really encouraging the confidence as mothers, as parents, as children, and finding and fulfilling our vocations, but also in caring for our children the way that we should. Another difficult aspect of birth and lack of care to infants and mothers and abortion is not just abortion itself, but the lack of care to infants sometimes born alive. This term is usually used for babies born during an abortion that are left to die even though they're born alive, and it's an odd distinction why it should make a difference. Actually, we're pretending that the baby isn't alive while it's inside the mother, but then when it's actually born, they're federally by law, once the baby is outside of the mother must be given care. But there are many states that don't enforce that and think it's okay to let the baby die, which I guess actually technically makes sense. If it's okay to kill the baby inside of the mother, what stops you from infanticide outside of the mother? What's the difference? Occasionally we're seeing the baby is not resuscitated when it's born. I like to use the example of your old movies. They used to show in old movies, sometimes they would show a baby being born and they would have the doctor smack him on the butt, because babies are often born not breathing. When they're born, they have to learn how to breathe. Their heart has to start beating the other direction. There's an awful lot that takes place after a baby is born, and they need stimulation. They need compassion, and if this isn't given to them, they will often just die. In the case where I was present, the baby was not cleaned off or suctioned and put on a table where the mother was held down and told that her baby was dead. Thankfully, she had somebody present who went and stimulated the baby, and the baby started crying. And it was only after the baby had been crying for a while that they cleaned the baby. I was not at that point aware that this is actually legal in New Mexico. And when New Mexico and Arizona last year both tried to pass the Infants Born Alive Act, they were discussing not just the babies that were born during abortion, but there were doctors that came forward that said, doctors and nurses that came forward and said, no, sometimes it's more compassionate not to resuscitate the baby if the baby is disabled or premature or born addicted to drugs, whatever cases we decide that a person is unnecessary. We need to watch for this in our medical system itself. In England, you are allowed to remove people from medical care, meaning food and water, and you can request that in America also. And I do know elderly people that have been denied care and who have died because of it, and their families have been very upset by it. We need to make sure that all life is given the proper care and treatment that it needs. We are not God, and we can't play God, and it's very important to have somebody present during birth, during hospitalizations. When we have a hospital system in America that is deciding that it's okay to kill babies in abortion or infanticide or allow them to die after they're born, that it's okay to deny care to elderly people. And we're not talking about extraordinary means. We're not talking about forcing people to have artificial lungs and things like that, but just ordinary care such as breathing, food, and water. Those are absolutely essential, and they are very critical to have care to a newborn baby in its first days. You need to be aware of as far as if you're participating in a birth, and it's not a judgment on specific doctors or nurses, other than that we need to realign our morals in our society. When it comes right down to it, they're right. What is the difference between saying abortion is compassion and deciding not to care for the baby in front of them? What is the difference? We have to be the voice for that difference.
So in conclusion, I would point out again that the way to solve these issues is to turn to God, to trust in God. But in trusting in God, as the Catholic Church teaches, we need to form our conscience. We need to form and trust our consciences, and we need to be confident in doing so, and confident when we're teaching the truth, to speak. It's very rewarding. It's very rewarding when you meet a young person, particularly a young woman, but young men who are contemplating these same issues, and tell them, no, abortion really is wrong, and you can have the baby. And this is what God intended. And they often will feel empowered. We're afraid to speak so often because we don't want to cause a fight or a difficulty, but we're depriving ourselves